What is rehab or rehabilitation? My name is Fred Bagares, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. What do I get for $350? This is probably the most common question that I get from my patients. In my clinic, the initial evaluation, meaning the very first time I ever meet a patient, I charge $350 for that care. Now, the obvious question is, what do I get for $350? My simple answer to that is availability, accessibility, coordination of care and management, and human connection. What is also part of the equation is understanding what we all currently receive. Here in the United States, we have a for-profit insurance-based healthcare system. The average copay is somewhere between $20 to $50 for an office visit. Paying nothing to potentially $50 is typical. Therefore, a jump to $350 for an initial evaluation is quite a massive undertaking. It's not what I charge for every visit, but it is what I charge for the initial evaluation, where I do a complete evaluation head to toe and a deep dive in their musculoskeletal history. I charge a separate price for follow-up visits, but again, I wanted to focus primarily on not the price, but the value of my care. In my style of practice, it's based off of how I believe my family should be treated. So I try to provide that level of care for my patients, exactly how I would expect my wife, my children, my parents to be treated. However, it's also driven by what I believe is currently missing in today's healthcare experience. So I'll refer to patients as kind of the consumer experience, right? So as an example, when people call my office, they get me. As soon as it rings, the person, when they pick up, is actually me. I don't have an answering service. I do have voicemail, but if anything, you might have to wait maybe somewhere between 20 to 60 minutes before I get the message and call back. Oftentimes, if I don't catch the call, it's because I'm with a patient or I'm in the middle of something. Now, contrast that to calling your physician currently. It's usually a point of frustration for everybody. As soon as you call, you have to go through a massive phone tree before you get to an actual human. And sometimes even at the end of that, you are left on hold. You know how they do, how all of a sudden you actually get somebody, and then before you even say anything, they say, so-and-so practice, hold please, and then they don't even give you the chance to respond. Worst case scenario, you're actually waiting, and then the call gets dropped. I've been through that. I'm sure you guys have been through that to some degree. Even in the best case scenario where you can finally leave a voicemail message and they call you back, or hoping that they call you back, and then they don't. And then you have to call them back to make sure they actually got your first message. And you guys kind of get what I'm hinting at. This type of experience just simply doesn't occur in my practice. I try to provide essentially a seamless experience. If you're calling the doctor, you're going to get the doctor. I just wanted that to be a integral part of the patient experience in my clinic. Patients already don't feel good. The last thing they want to do is wrestle with a computer and then not actually be able to communicate their needs. In terms of availability, the problem with the insurance-based model is that these are typically high-volume clinics. 10 to 15-minute visits packed into an 8-hour day. These clinics fill up quickly, and it can take several days, sometimes weeks, and in the worst case scenario, sometimes a couple of months in order to get a visit. In contrast, my visits typically range between 30 to 60 minutes of direct face-to-face time. In order to create this type of experience, I have set up my clinic and my day accordingly so that I am able to spend the most amount of time with my patients that I see fit. So, again, providing access to me and availability is one of the most important things that I believe any physician or clinician should prioritize. Because it's sometimes so frustrating for the patients where they finally get to the point where they can schedule an appointment only to find out that the next time that they can be seen is several weeks or several months out. That to me is just horrible. That's not actual healthcare. At best, it's just non-management or mismanagement of an issue. I personally don't think that that's the way that people actually get better, which is why I make it a priority to be able to take care of my patients within 24 to 48 hours. In terms of clinical management, being prepared to see my patient is a top priority. I remember as a medical student, it used to really frustrate me when I would see some of these patients that were very complex. They schedule an appointment, they have their medical records, imaging reports, things like that, sent. But when the actual appointment comes, they're not in the system. As a result, they would end up being seen, pieces of information are missing. The patient is frustrated because they could swear that a referring doc sent it. They called the referring doc's office, they confirmed it, and now they're trying to recall what was actually being done or said at the previous visit to the consultant. And essentially now everybody's frustrated. The patient's frustrated, the referring doc is frustrated, and so is the consultant, because now the visit is an incomplete picture. So what ends up happening is that the consultant says, well, I'm going to have to request that information again, and we'll schedule a follow-up, or I'll call you later when I get home after I have a chance to review everything. Now, the whole situation is dependent on them actually getting that information. So they have to refax a records request. From there, it has to be received and acknowledged, and hopefully the person that receives it actually sends it back. That's just a lot of steps. I personally don't like to leave things up to chance, so I personally just do things myself along with my wife. Anytime that I see people, I aggressively get as much information as possible before I actually see them. If I know that I have a patient that's been seen by several physicians, I will get all of that information in a timely manner before I actually see the patient, because I don't want to waste their travel time, their clinic time, and I certainly don't want them to be more frustrated than they already are. I want to be able to review the information, talk to them, at least prior to the actual appointment. I don't like it when patients feel like their physician is learning about them during the visit, or they don't feel like that they're prepared. It just simply doesn't provide a great patient experience. If anything, I believe that patients feel comforted when they feel their physician has studied them. As physicians, we are typically great students. We take in large amounts of information. We can retain it and come up with a game plan and apply it. The last thing that I want to see as a patient is a physician that's kind of fumbling through their notes, trying to find stuff, and it's very, very clear that they don't know what's going on. They don't remember their own game plan from the previous visit. They don't understand what treatment has been done to them in the past. And they're all recommending a repeat treatment that a previous doc has tried and the patient has failed. So it ends up just being a hot mess. The last thing that I'll mention is the human interaction part of things. One of the core principles of my practice is that I do not charge for human interaction. What I mean is, simply communicating with the patient. I don't believe that we should actually charge people, per sentence or for every 15 minutes. I recently saw a local healthcare system talking about they were going to start charging people for access to the patient portal, which is essentially kind of email, a secure email type system. And so it's sad, but it's like that's supposed to be like a feature That's not something to highlight. If anything, it highlights the bug in the system. You shouldn't have to charge people for, a simple question that they should already be answering. You know, a lot of times, because the clinics are so busy, physicians will use the portal as a way to communicate with the patient, but a lot of times it's because that information was not communicated during the actual in-person visit. So it doesn't feel right to me. I don't really like it. So at least in my practice, I highly, highly utilize email, text messaging. Sometimes if I feel like the person needs to talk, I can get on the phone fairly quickly. Every now and then, if I get the sense that this needs to be a more formal visit, then I bring them back, and that's a separate charge for that time. But simple questions, they run across something on TV. They wanted to make sure that there's no side effect to their medication. That can be handled with, something simple as a text. I find, at least in my practice, that people do like the texting feature a little bit more than email. Plus, I got into medicine because I truly wanted to help people. I wanted to see how people do. So whenever someone gets an injection or they went to physical therapy, it's pretty common for me to check in on them. You know, how did your therapy go? How did the injection help you? A lot of this stuff, again, can be managed by text, and I find that my patients really appreciate it. I remember one particular interaction. I was, essentially I kind of apologized to the patient because in a way I felt intrusive, because I was like, well, they were doing really, really well the last time I saw them. I sent them a text, 3 to 4 months later, just as a check-in, just like, hey, how's everything going? And, I had to stop and say, like, I really hope that I'm not bothering you. And they did share that they really appreciate it. I think that it's kind of sad to me, is the bar that needs to be set, you know, as a physician. This is where I believe we should be functioning at, versus, the constantly disappointing people, meeting very, very low expectations. So that's the value that I bring. So I'll end today's episode with one of my favorite quotes from Warren Buffett. Price is what you pay, value is what you get. We can focus on the price or the value. The value of my visit includes availability, accessibility, ease of scheduling, management and care coordination, and of course, the most important, getting an actual human on the other end. This does obviously beg the follow-up question of, do we actually value the care that we're receiving in the insurance-based model? Is the care that we are currently receiving meeting our needs? Just some food for thought. Have a great day. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.